For those of you who are new, my name is Lisa and I'm a registered nurse. I have worked mostly pediatrics, maternal child, and then I became a case manager for soldiers and a case manager for children. Currently, I do home health. I love to talk about anything related to medicine, medieval medicine, what's going on in the future, how transplants are done, all kinds of interesting topics. I also like to discuss how you can be your best advocate and that speaking up is okay and very important. And I'm going to talk about that in this video. But consider subscribing if you like information like this, myths and facts about medicine. I also do other fun things as well. Next week, I'm going to be in California. I'm going to get this fixed and touched up and new colors. And I'm also going to go to the Book Fest. I guess it's the biggest one in the United States right now, and it happens to be in Southern California, so I'm going to take you with me. I hope that you share, consider subscribing, and please don't forget to like. Hi guys. Okay, listen. I want to tell you about a story about Mr. Donald Church and what happened to him. And again, as always, how do these errors occur? Most of it is human error, maybe cutting corners, not having policies in place that should be in place. And I'll give you an example by telling you what happened to this gentleman named Donald Church, age 49 at the time of his surgery. His surgery was in Seattle, Washington at the University of Washington Medical Center in June of 2000. He had a mass in his abdomen that was malignant. So he needed to have major surgery. He needed to have that mass removed, part of his large intestine removed, and his appendix removed. But after that went fairly well for the surgery, and apparently he had a good outcome as far as his cancer goes, although I haven't been able to read too much follow-up on his life. But look what happened. Look what was left inside him. What in the world? Okay, guys, there's lots of different kinds of retractors. This is called a malleable retractor. There are other names, different types of retractors. This one was used on Mr. Church. Look at this big thing. It was used when the time of closing occurred. So apparently with this retractor, the wound has occurred. This goes inside to protect the organs while stitching and closing occurs. From what I'm understanding when I read about his case, that some of it, of course, is supposed to be left out as the closing occurs. But the whole thing was left inside him. They just closed him up with this inside him. Here is a 12-inch ruler. This one is a little over 12 inches. And I know that things are transposed sometimes using a camera and not or using a phone and not a camera. But his retractor was 13 inches and it was 2 inches in width, which is exactly what this one is. So Donald Church is done with his surgery at University of Washington, which by the way is a fantastic medical center. It's sought after for people who apparently want to do their surgical residency in a place here in the Pacific Northwest. It is good enough that I absolutely trust it. It's more than good enough. It's one of the best. I trust them. I've had surgery there. I've had 2 surgeries at University of Washington. My mom's been a patient and had surgery at University of Washington. Harborview is connected with University of Washington Medical Center. Seattle Children's Hospital also is, and another hospital. They work together. And you know, Seattle has some of the best medical centers. But like I said in my other video about the person who had the wrong rib removed at a different medical center, that accidents can happen anywhere. Things are put into place for safety, patient safety. It's always the number one thing that hospitals are thinking about and working on continuously. This, like I said in my other video too, wasn't a surgical error that was intentional, but it happened and the damage is done. Okay, so first of all, how did he know that this was left in him? So Donald Church continued to have, understandably, pain. His pain never went away. I'm going to read to you exactly what his words were about his pain. Donald Church said the pain never went away after the operation that removed his tumor, his appendix, and part of his large intestine. As soon as he got home after a week in the hospital, The instrument began causing problems. Moving around in general caused Church pain. He could not have a proper bowel movement for days and days at a time. The retractor pushed and poked at his insides. He sometimes felt a bulge in his abdomen. It was like a cycle, he said. I would have pain first in my abdomen, then in my chest because the thing was moving up and down. There were times that I would just lie on my bathroom floor sobbing because I thought I must be dying. During his post-surgical appointment, they explained after 30 days of this pain that this could be post-op pain, just regular post-op discomfort. But it continued, and another month went by, and he could barely work. He couldn't bend over. He knew something was wrong. So he went to his family medicine doctor, and that person, I think that person was at University of Washington as well, and that family medicine doctor ordered an abdominal CT, and they found the souvenir during the abdominal CT. What did the University of Washington Medical Center do when they found their big major error? They did what they should have done. They apologized. They apologized to the patient. They apologized publicly. They took full responsibility for this error. And then they changed protocols in the operating room where not just a list of other things are counted during and after surgery as time goes on, particularly after, but also that large instruments are also counted. So they changed that. So they did all the right things because research has shown that apologizing as soon as you can, immediately or as soon as you are able after a medical error has occurred, has better outcomes for litigation, for the patient. You have angry patients and family members and patients that feel they cannot trust the medical system. But when the medical system takes ownership, doesn't try to hide it, but says, we really screwed up, this should not have happened, and we're very, very sorry, and then they compensate the patient, then that doesn't make it go away. It doesn't always take care of the PTSD that patient has afterwards. Or maybe just because you give an apology, if somebody has an outcome from an error that is absolutely catastrophic and devastating, it's not always going to fix that, of course, but it's the responsibility of the medical center to apologize sincerely, compensate, fix the problem, and acknowledge their error. I really liked what Donald Church said here as well. He said in an interview, we're not talking about leaving a wrench in somebody's car engine. We're talking about top surgeons at a major hospital doing this. This is somebody's life. Mr. Church lives in the Seattle area, or he did at that time, and he was at that time a technician for a pest control agency. So how did this get removed? After they figured out what happened, Mr. Church then went for a surgical consult to have it removed at a different medical center in Seattle altogether. You have the right to do that. It's okay to ask questions. Remember, before surgery, be your best advocate. You are your best advocate. You're going to do all the things you possibly can to help so that errors don't occur. And I talk about this a lot, about marking the site, asking questions, understanding exactly what your consent form says. And if it says right hip, but you thought it was supposed to be the left or vice versa, please speak up. Please feel that you can speak up. Ask questions. If you're having post-op pain that seems extraordinarily unusual, please feel free to go to any doctor, other doctors, ER, and continue until you have resolution.